gastroenterologist reveals 5 surprising causes of bloating and IBS. Today, we're discussing the topic that affects millions of people: bloating and irritable bowel syndrome. To help us uncover the root causes, we're joined by none other than Dr. Will Bulsiewicz, a renowned gastroenterologist. Why do we bloat? Dr. Will explains, this is one of the most frequent reasons people visit a gastroenterologist. And while it might seem simple, the causes of bloating are actually more complex than most people realize. Let me walk you with 5 potential reasons, some of which might surprise you, and hopefully, this will help anyone watching today. A damaged gut: Dr. Will's top suspect. Dr. Will explains, first we have to talk about the foundation of gut health, the microbiome. Think of it as a thriving ecosystem inside you, filled with bacteria, yeasts, archaea, and even some parasites. Many of these microorganisms are incredibly beneficial, like a parasite called blastocystis, which actually supports gut health. When this ecosystem is balanced, your gut is strong and resilient. You could go out for spicy Mexican food and your gut would handle it just fine. But when the gut is damaged, that balance is lost, leaving you vulnerable to bloating and discomfort. Dr. Will lists common culprits behind gut damage: antibiotics, poor dietary habits, lack of exercise, inadequate sleep. These factors, Dr. Will adds, are unfortunately very common in today's fast-paced lifestyle, especially in the US. A damaged gut often leads to conditions like irritable bowel syndrome, IBE, or small intestine bacterial overgrowth, SIBO, both of which are notorious for causing gas and bloating. How to spot a damaged gut? So, how do you know if your gut is damaged? Dr. Will breaks it down into 3 telltale signs. 1. Your bowel movements. Pay attention to your stool, Dr. Will advises. It should look like a soft, torpedo-shaped sausage and pass effortlessly. If it's hard, lumpy, or comes out in small balls, you might be constipated. On the flip side, if it's loose and watery, that's diarrhea. Both are signs that your gut isn't functioning properly. Digestive symptoms. If you feel gassy, bloated, or uncomfortable after eating, that's another major red flag, says Dr. Will. 3. Non-digestive issues. There are conditions outside the digestive system that could indicate gut problems. If you're experiencing unexplained fatigue, skin issues, or even mood swings, your gut could be playing a role. With this foundation laid, Dr. Will teases, and that's just the beginning. Let's move on to some of the other causes that people often overlook. Dr. Will discusses the connection between gut health and various medical conditions, pointing out that a damaged gut can manifest in several ways, affecting metabolism, immune function, hormones, mood, brain health, and contribute to common issues like obesity, insulin resistance, and type 2 diabetes. Often, patients seek help for digestive symptoms like gas and bloating, but their medical history reveals a more complex picture, with multiple conditions, such as being overweight, having endometriosis, or polycystic syndrome. He explains that assessing gut health involves not just looking at digestive symptoms, but also considering bowel movements and the presence of other medical issues that could indicate gut damage. Dr. Will emphasizes that gut dysbiosis, imbalanced gut bacteria, is challenging to diagnose, while popular, are often unreliable due to a lack of clinical validation. Dr. Will further elaborates on his work with Zoe, a company that combines stool testing, continuous glucose monitoring, CGM, and lipid testing to provide comprehensive insights into gut health. When discussing the second common cause of bloating, Dr. Will points out that constipation is often the primary culprit, rather than food. Despite many people not recognizing their constipation, he insists that almost everyone with constipation will experience gas and bloating. The key, he believes, is improving bowel motility to get the digestive system in rhythm, which can significantly reduce or eliminate bloating. Dr. Will explains that constipation is not just about how often you visit the bathroom, but also about fully clearing your bowels. Incomplete emptying, even with daily movements, can lead to discomfort like gas and bloating. He suggests improving digestion by using fiber supplements and 500 milligrams of magnesium before bed, adjusting the amount if needed. He advises consulting a doctor before starting supplements. Dr. Will highlights the importance of magnesium and fiber in managing constipation and bloating. He explains that many people in the US are magnesium deficient, and taking 750 to 1,000 milligrams of magnesium can help stabilize levels and improve digestion. Fiber also plays a crucial role by supporting bowel movements and nourishing beneficial gut microbes. Dr. Will also discusses FODMAPs, a group of carbohydrates-based foods that can produce gas when fermented by gut bacteria. While FODMAPs are beneficial for most people as prebiotics, they can be problematic for some, especially when consuming dairy or artificial sweeteners. Finally, he touches on a study from the University of North Carolina, raising concerns about the effects of artificial sweeteners such as Splenda on gut health. He advises avoiding artificial sweeteners as part of a healthier dietary routine. Artificial sweeteners, while a sugar substitute, may harm metabolism over time, leading to insulin resistance and weight gain by disrupting gut health. Similarly, histamine intolerance for high histamine foods like fermented items, certain fish, and vegetables can cause symptoms like gas, bloating, and rashes. Healing the gut and using supplements like quercetin can help. Swallowed air from habits like drinking carbonated drinks, using straws, or eating too fast also contributes to bloating and belching. Stress and anxiety can worsen this by increasing air swallowing. Mindful eating, avoiding triggers, and managing stress are key to reducing symptoms. A holistic approach, including dietary adjustments and mindful habits, can greatly improve gut health and overall well-being. Bloating stomach tips. Struggling with a bloating stomach? Here are 10 simple tips to help you reduce bloating quickly and effectively. 1. Avoid gas-producing foods. Certain foods like beans, lentils, and chickpeas contain complex carbohydrates that are hard to digest, leading to gas buildup. Additionally, foods like potatoes, corn, and bananas contain resistant starch. This starch isn't fully absorbed in the small intestine and is later fermented in the large intestine, producing gas that can cause bloating. 2. Incorporate probiotics. Add probiotic-rich foods to your diet, such as yogurt, improves digestion and balances gut bacteria. Kefir helps prevent food fermentation in the gut. Tempeh, a fermented soy product that supports a healthy gut environment and reduces gas buildup. A balanced gut flora not only improves digestion, but also prevents the fermentation process that often causes bloating. 3. Stay hydrated. Drinking plenty of water helps flush out excess salts and toxins from your digestive system. This not only reduces bloating, but also supports digestion and helps release trapped gas in the intestines. 4. Cut back on artificial sugars. Processed foods containing artificial sweeteners like sorbitol and mannitol are tough to digest. These sugars linger in the intestines, undergoing fermentation that leads to gas formation and bloating. Limit dairy products. If you're lactose intolerant, consuming milk and dairy products can lead to gas production and bloating. Undigested lactose is fermented by gut bacteria, which worsens the problem. Opt for lactose-free alternatives to avoid discomfort. 6. Stay active. Regular exercise aids digestion by speeding up the absorption of food, reducing the time available for fermentation. It also enhances circulation, lowers water retention, and alleviates stress, a major contributor to bloating and digestive discomfort. 7. Try relaxation techniques. Stress can negatively impact digestion. Practices like yoga and meditation can reduce stress levels, improve posture, and alleviate pressure on the intestines, minimizing bloating. 8. Slow down. When eating too quickly can lead to swallowing excess air, which increases abdominal pressure. It also reduces the production of digestive enzymes, resulting in poor digestion. Chew your food thoroughly to prevent fermentation and gas buildup. 9. Choose natural digestive aids. Incorporate digestive spices into your meals, such as cinnamon, cumin, and coriander. Boost the production of digestive juices. Cayenne pepper and cardamom stimulate bowel movements and prevent bloating. Fennel and mint help reduce fermentation and gas buildup. 10. Skip carbonated drinks. Carbonated beverages are loaded with carbon dioxide, which can lead to gas formation in the stomach and cause uncomfortable bloating. Dealing with bloating can be uncomfortable, but with the right tips and understanding of the causes, you can find quick relief and take control of your well-being. If you found these tips helpful, don't keep them to yourself. Like and share this video with others and help them discover ways to reduce bloating too. And if you're looking for more health advice, be sure to subscribe to our channel so you never miss out on practical solutions for feeling your best. Thanks for watching. See you in the next video. C.